Advancements in MS cannot happen without a team of dedicated people supporting patient advocacy, research, and education. June Halper, CEO of the Consortium of Multiple Sclerosis Centers, and her colleague, Tina Trott, reflect on CMSC's history and the significant milestones the organization has experienced over the years.
My name is June Halper. I'm a nurse practitioner, and I work for the Consortium of MS Centers. We're here to talk a little bit about the work that Tina and I have been doing. Tina and I have worked together for 18 years, and in Hebrew, 18 is a very important number. I don't know if you're familiar, Tina, but when you say a toast to someone, it's l'chaim, to life. So I think we've done a lot together.
We certainly have. What brought me to the consortium is a personal connection. My father was diagnosed with MS in
Long time ago.
Yeah, a long time ago. And I think everyone here at this organization has been affected by MS personally, and that's why everyone is so passionate about our work that we do at the consortium. And June, I would like you to speak a little bit about why the consortium started and what the founding members' vision was.
Well, before I start that, I never knew anybody with MS, believe it or not. And when I somehow landed in the world of multiple sclerosis, I expected everyone to be in wheelchairs and with just progressive disability. And to my surprise, even in the early 1980s, doing meetings, people walked in, and they were just like you and me. Of course, they did continue to get worse over the years, but things have changed so. And I think, have made a great difference, you and I, in our partnership together in the things that we've accomplished. When I first started working in MS, there was not much in terms of medical care. People were told, go home and live with it. And if you have a problem, give us a call. But there really wasn't much to do except to sort of pat their head and treat them for a relapse and then tell them to go home. And then some visionaries came along, visionaries who were doctors, but there were no nurses at that time. I was sort of one of the outliers in terms of a nurse with an interest in MS. And they decided that in March of 1986, which was way before anything really was happening in the disease, that we needed a network of MS centers, that MS centers would provide a comprehensive care approach to people with MS. And then a few years later, you came into the picture to work with me, and the consortium kept growing.
We have done a lot in 18 years.
That's right.
Honestly, I mean, I think our membership and all the doctors and nurses and pharmacists and physical therapists and psychologists have really contributed to the advancement of MS care.
Right.
And it's continuing. It's never going to stop at this point.
Well, I think we're a good model for other diseases too, don't you think?
Oh, absolutely.
In terms of the team approach.
I definitely agree with that. We've had a lot of people reach out to us to sort of learn our organization and why it functions so well. And
if you remember when we first started the consortium, we were actually right next to the MS Center at Holy Name. And we used to have our team meetings and our collaborative interaction with patients. We had many patients who were volunteering at that time.
That's right.
And it was such an ideal model of care. And so many centers have opened since that time. I wish I could visit them all, don't you?
We had that great program, How to Set Up an MS Center. I mean, that's
right.
Honestly that's why we have 200 member centers now, I believe.
Right. So in 1997, because there were so many nurses that showed up at the meeting, they decided that we needed to form an organization of their own. And in Calgary, Alberta, actually, we had our first official meeting of the IOMSN. And now it's become a worldwide organization with MS-certified nurses all over the world. And one of my friends asked if she could do a survey, and so we did. And she got 40 responses from Australia. She says, whoa, she couldn't believe it. So we really are international with the exam. We have a certification exam that covers nursing and nursing care throughout the world and done in many languages. So that's pretty exciting.
And from that exam, we also developed the MS specialist exam.
That's correct.
Which is for healthcare professionals, physicians, pretty much anybody.
Right. And this year, our big one is the medical assistants. We have an exam now for MS Health Associates for people that are not licensed as nurses and PTs are. So we'll be offering it in Nashville.
first time, yeah. It's very
that's going to be
exciting stuff.
exciting. That's very exciting. Yeah. So with other landmarks, I know you started in 2000, but in 1999, just before you showed up, we started the journal online.
That's right.
We were kind of ahead of ourselves because it was an online journal only. But then in 2000, the same year you came, we started publishing it. Remember that?
I do. And
Yeah, and we've published a lot of issues ever since then. We're now up to 6 a year.
right, with some accredited articles in there.
Yeah, well, that was another landmark that you really participated in, the wonderful, lots of work
Right.
that we did to get us accredited for physicians in 2009. And now in 2017, we're accredited to provide education for nurses, physicians, and pharmacists. So that's another golden opportunity and more work for you, my dear.
That's
Sorry
right.
about that.
And we're also accredited for occupational therapists and psychologists.
Yep.
So we're really trying to help our members.
Well, the biggest part of, I think, and one of the biggest landmarks was 93 when we named NARCOMS, remember? And well, you weren't here, but NARCOMS has generated so much information about MS. We now know things that we never would have known because the patient registry has told us that things like smoking, obesity, vitamin D, all the things that we're starting to learn about comorbid issues in MS have actually been generated from our registry. And I don't know, I feel kind of proud of that, don't you?
I definitely feel proud of
Yeah,
that.
and then NARCRIMS in the past couple of years, which is a clinical registry. We're really starting to, I think, make great inroads. But I think the biggest inroad is the team approach, don't you?
Absolutely, and I think that all started with your first annual meeting.
That's right. In the backyard of Randy Shapiro's MS Center at St. Mary's Hospital. We actually slept in hospital beds that night, and then we barbecued steaks in the back. Although I'm vegetarian, I didn't eat the steak, but it was fun barbecuing.
Our consensus conferences, when we get our team together, different members of our committees working on guidelines for MRI and
Rehab, symptomatic management,
cognition.
yeah, psychosocial issues. So I think it's always involving the team. I think that makes us so different, that no conference is just a doctor or a nurse or nurse and doctor teams. We always include the whole entire team, and everybody has a point of view. And I think what makes us different is the level playing field. I mean, it's like we run our office on a level playing field. We all here have an equal say about what we have for lunch and all the things that we do for the annual meeting. But I think the organization itself reflects that level playing field. I think one of the proudest moments that I had was using our model of team building and that level playing field by forming the MS Coalition in 2005. Didn't you feel that was a great big step in terms of building alliances and getting the voice out?
And sharing our services with other organizations.
Yeah. I think the coalition, and of course, this year we're going to be having a coalition meeting for people with MS, both patients and families, right after our annual meeting in early June. But I think that our philosophy is really starting to spread. You know, again, level playing field, coalition building, team building, because we're all in the same boat. You know, we're not competing with each other. I think just trying to enhance the quality of life of people with MS, and it's not just people with MS, but everybody that's affected, the families, the friends, and of course we've learned so much. And I think it's a little scary to know that now MS is being diagnosed in kids, the pediatric network. As well as older people. Remember, they used to say that people as they got older couldn't get MS, and we now know that that is not true. And I think the other thing is that whole philosophy of wellness, learning that smoking and vitamin D and obesity can affect MS, actually takes us to the next level, which is a wellness approach. Don't you see that even with our curriculum?
I definitely see that. I think it's great that we have a lot of physical therapists and occupational therapists working with patients to give them the best quality of life out there.
Yeah, I'll never forget when I first started in MS. This was 1980. We had an annual meeting, and there was a Dr. Leib Scheinberg, who actually was my mentor. But I actually still have the tape where he says, "Don't stand if you can sit, and don't sit if you can lie down." And that has changed so extraordinarily.
That's very true.
Exercise, activity is so important in MS, and taking control of your life. You just don't lie down and let it go over you. You take control of it. And,
That's right. And diet and just yoga. There's so many different.
absolutely. Yeah, it's sad that your dad never really benefited from
That was
these kind-
before all the drugs were available too. I mean,
Right.
disease-modifying therapies have really come a long way.
Right, didn't you see that? Remember, well, you weren't here in 93, but I think one of the things I saw in 1993 when the first drug beta-seron was approved, all of a sudden things started to change. People started to develop a more positive attitude towards the disease. People themselves realized that they should stay working. They shouldn't go out on disability. They should continue the quality of life that they want to have and not make MS their career. So, Tina, we have a lot of work to do. I think that the more we learn, the more we need to do, and the more work that's going to come your way. And I love working with you.
I love working with you too, June.
Good.
It's been great lifetime experience.
Well, great 18 years.
Yes.
A lot more for me, and hopefully a lot more coming down the pike. So thanks so much for all that you do to help me make my day. And
Thank you very much.
oh, you're welcome.
Thank you.